Hi, I'm Natasha Oates, award-winning therapist, and I am here with an amazing gem in our city. I'm here with no other than Dr. Gina Duncan. She is with Eastover Psychiatric Group, and we're going to have a chat because this is Minority Mental Health Month. And if you don't know, only 2% of psychiatrists in the US are Black. Only 2% in the whole nation. And so, what a gem that we have that we can sit and chat with you. Welcome, Dr. Duncan.
Thank you so much, Natasha. I'm really glad to be with you. And particularly, as we enter Minority Mental Health Month to have this conversation.
I'm so excited, and thank you for taking time out of your busy schedule. I'm sure lots of folks are coming to you, with this as much beautiful work that you do, and with the rarity that you provide as well.
Well, thank you. Anytime I have the opportunity to, talk about mental health, particularly in the Black community and in communities of color, underserved communities, I'm always excited to do that because it's so important.
Right, it is. It is. And it makes me a bit curious with the numbers being what they are. What drew you? What gave you the push to go into psychiatry?
It's funny. So my interest in psychiatry actually started out as an interest in psychology. When I was in, say, like early high school. So my childhood best friend and I um, loved to what we called psychoanalyze people.
Mhm,
Like
mhm,
you're going through school, you're trying to understand like what makes people behave the way they do, and we would have these like long conversations and so on about that. And I love to talk. That's another thing too. I've always loved to talk.
okay.
And just again to understand what makes people think the way they do and behave the way they do. And so by the time I was about in 10th grade, I knew that I really wanted to do something related to like talking and emotions and helping people. My dad is a minister, and my mom is a teacher. And so that also being able to help people and
Mhm,
educate people, and then my faith, my own personal faith, is very important to me. So I was already at that age starting to get a sense of wanting to bring those things together. And then in 10th grade, I took chemistry, general chemistry, had a wonderful teacher, loved chemistry. And my dad said, if you like chemistry, you should really think about majoring in chemistry. And then you could go to medical school. And in medical school, from there, you could go into psychiatry. And as a psychiatrist, you can do what a psychologist does and do therapy, but you could also prescribe medicine.
mhm.
And I was like, that sounds great. And so, really, from that age, I was like, yep, I'm going to medical school.
Yeah. What a beautiful way to marry all of the sides where you're drawn to helping. It's literally in your blood, right?
Yeah.
You're drawn to helping, having impact, making sure people are understanding their circumstances, their potential, and then your love for science, for chemistry, just marrying that all together.
Yeah, yeah. So I really do credit my dad and my mom for, identifying and seeing in me like, some unique giftings that I had, and then helping me to, they didn't say this is what you have to do, but just sort of guiding me in that direction. When I got to medical school, I actually wasn't so sure at that point that I would go into psychiatry. I knew I was really interested in women's health. I thought
Mhm.
about, being an OBGYN or a primary care provider, family physician. But then I did my
Mhm.
rotations, and psychiatry just felt like the best fit because in primary care there were so many issues that people were dealing with, like diabetes or hypertension, but their ability to take care of themselves and to follow through with the lifestyle changes that they needed were impacted by depression and anxiety and other mental health challenges. And so I just really felt that um, I really do see my work as my ministry. And so I felt that my calling is to be able to help people from that, the mental health aspect of things, for in order for them to have a more holistic health and well-being, physically, mentally, spiritually, emotionally, and all of those things.
Yeah. Ooh, I love that. I love that. So you're seeing that the mind is connected to our overall health.
Oh, absolutely.
If you can help people with the mental and emotional health, it can have a trickle down effect as well. And I'm all about like if you're watching and you feel like that sounds like me, I want to help people and I'm interested in chemistry, come on over, come on over. Because listen, we need to boost this 2% up.
We do. And I think it's important to know too that I have also, just as a quick aside, I previously was the associate dean for admissions for the Medical College of Georgia for 3 years. And
Mm,
so having sat and led an admissions committee admitting students into medical school, you don't have to major in chemistry to go to medical school. You don't have to major in biology, although that's the most common path. People can major in psychology, sociology, you could major in dance. And if you
wow.
also do your prerequisite, so I don't want to make it seem as though you have to, take that particular path. However, yes, we need more. We need more people of color in medicine and whatever path you need to get there. I think it's following what you are passionate about. For me, I was passionate about chemistry, but not to go on to be a PhD scientist, which is what my husband did,
Wow,
but
look at that.
rather to go into medicine.
Okay, okay. Thank you for making that distinction that there actually are many paths to enter into psychiatry. It's not just one way. I appreciate that because somebody might think, well, I didn't go that path. Um, but like you said, it could be psychology, it could be dance.
When it comes to your undergraduate major, there are certain prerequisites that have to be taken to apply to medical school
Yes.
and taking the MCAT. But what we need are well-rounded physicians, and you do have to go to medical school and then to go on to residency to practice psychiatry. But
Mhm.
what you do prior to your medical school career, I really encourage people to really think about what they're passionate about and to do that, because that will shine through when it comes to your medical school application and beyond.
Right, right. So thank you for helping folks do some research because you just shared, there's some prerequisites that are involved, the MCAT that's involved, and something that I took away too from what you shared earlier, you had people around you who could see things in you, gifts in you, encourage you, not pressure. So all of these things are really standing out to me. Wow. Something that I found really interesting and you made mention too is this is your calling. You grew up with a dad who was in ministry, and from your bio, I saw that you created a lot of partnerships with churches, with organizations that serves our faith community. I'm really curious about some of the barriers you've seen that are unique maybe to the Black church and because sometimes we have some hangups about getting assistance with our mental health, especially adding in medication. What have been those hurdles that you've had to help people overcome to know that it's all right? You can have Jesus, you can have medication, you can have therapy, you can have all the components that will help with holistic health.
Yeah, absolutely. That's such a great question, and one of the things that I'm probably the topic I'm most passionate about.
Yeah.
Um, I think that one of the things that's really important to kind of understand, and I am coming to understand even more fully myself now, particularly given the times that we're living in, is the impact of racism and racial trauma
Mhm.
on the stigma around mental health and well-being.
Right.
There is stigma that exists, unfortunately, in every culture around mental health. But I
Mhm.
think that for Black people, African Americans in the United States in particular, has already been a stigma around being Black,
Yeah.
and there have been so many aspects of our history, heritage, culture, cultural representations and manifestations that have been pathologized,
Yes.
that it prevents people from wanting to take on more stigma. So, I read this in an article that I used for some research that I was doing once. It was like, I'm already Black and I want to be Black and quote unquote crazy. So
Yeah,
to say
yeah.
like, you've got something, a mental health challenge, there's stigma, around that
Hmm.
that prevents people from seeking out care. But then also there is the reality that our community has suffered medical trauma,
Yeah.
and that many people have experienced in the past and even unfortunately in the present, stigmatizing experiences with mental health providers, with other medical providers. We're aware of the Tuskegee syphilis experiment and other situations throughout the centuries, really, that have created mistrust. And so that is another reason that there is a hesitancy oftentimes in our communities to reach out for
Mhm.
help.
Mhm.
And then at the same time, there exists alongside that, particularly, and as Black people, we're not monolithic, but I'm speaking from my own, personal experience, Black Southern Christian, experience. Alongside that, there is this tremendous source of resilience and strength and faith and deep abiding faith, which has been therapeutic for us. And so it's not an either or. And I think that's one of the biggest hurdle is the idea that, like, well, if we can't trust the medical community, then we shouldn't try to address or reach out for help. And or the idea that if I believe, and I'm too blessed to be stressed, right? That idea. I say, well, you can be blessed and stressed.
Yes, certainly.
Faith does not exist without, faith is not the absence of fear. Faith is, you have fear and you have your faith, and you may have to just walk forward with both of those at the same time. So
Right.
I don't want to get too far off your original question, but there are a lot of complexities there. And but to me it does, part of, again, why I feel like I have this calling is the idea that we can both believe
Mhm.
and make use of the resources that God has provided in the, such as therapists and medication when needed.
Right.
And none of those things have to contradict, but it's important to have an understanding and to be working with a provider that understands and respects and supports
Mhm.
that, all those dimensions.
Right, right. It doesn't have to be all or nothing.
No.
And we indeed are mind, body, and spirit. And so we want to nourish all parts for our total wellness. And I love that you're saying they don't have to choose.
Right.
Yeah,
Right.
yeah.
Um, Yeah, and I will say, just in my own experience as a psychiatrist, some of the most profound changes that I have seen with patients that I've worked with, because I do both therapy and medication management in my practice. But some of the most profound experiences that I have seen have come from the spiritual transformation that someone has had as they've been working through whatever the challenge was that they had. And it wasn't ultimately the medicine that I prescribed to them or something that I said in therapy or that someone else said. But it was all of those things working in concert, but there was that sense of them connecting with an understanding of why they were going through what they're going through, what God may be
Mhm.
doing through this experience with them,
Right.
that can be really transformative. So I've seen all of those things, working together.
Beautiful, beautiful. So you've seen, when someone is leaning on their faith and they're also doing their work in their mental health journey, just the beautiful outcomes
Mhm.
that have taken place. And so we don't, for you all who are listening in, we don't want you to miss out on this. If you've been thinking about getting some assistance with your emotional and mental health, this is the time. This is the time. And speaking of just talking about different mental health conditions, I think with AI and Google, everybody's now an expert on finding out things and seeing things. But sometimes we miss really important signs and we'll label things that may not be accurate. Um, I'm OCD or or even missing certain signs like ADHD. And I know those are some of your specialties too that you've worked with, helping people to work through. What are some signs that we overlook for someone who truly has symptoms of OCD? And I know that these are two different conditions, but OCD and ADHD. What are some signs that we just maybe minimize, overlook, that maybe someone, if they're seeing these certain signs, maybe they should come and speak with a psychiatrist about it and just get a screening?
That's a great question. So I think that the first thing I always like to say when talking about these sorts of things is to frame this in that mental health conditions it exists on a spectrum. So
Hmm.
the anxiety and depression, for example, the feeling of anxiety or sadness, right? Those are normal human emotions. So we don't want to pathologize normal experience. And when you talk about something like OCD, even where there is obsessive compulsive disorder,
Yes.
which means having kind of repetitive, intrusive thoughts,
Mm-hmm.
and then compulsions or things that you feel you have to do in response to those repetitive and intrusive thoughts. Everybody, all human beings have intrusive thoughts,
Yeah.
thoughts that pop into our minds that are, unwanted, and you're like, what? So it's not that only people with OCD have intrusive thoughts. What sets mental health conditions or mental health disorders apart from um I hate to even say normal, but what sets them apart is the intensity and the frequency and the extent to which they impair your ability to do the other things that you need to do. So
Yes.
everybody has intrusive thoughts at some point in time. A person who has OCD, though, they have that intrusive thought, and let's just say it's a thought of, I touched this doorknob and I feel like I'm contaminated now with,
Mhm.
I've picked up some germs. A
Mhm.
person without OCD may touch the doorknob, and it's good hygienic practice, right? You touch something is dirty, go
Mhm.
wash your hands.
Mhm.
A
Mhm.
person with OCD, however, may go and feel like they need to wash their hands repetitively. They may wash their hands and then say that I still don't feel clean, or I need to do this 3 times,
Mhm.
or I need to do this 5 times, or I need to turn the knob on and off. And so, what I'm trying to say here is that, as you can tell, when someone has OCD, it's not only the intrusion and the compulsion, it's the need to do things a certain number of times. And it's the amount of time that then takes away from the other things that they need to do, the distress that it may cause. I have, patients that I work with who talk about having rituals where at night before going to bed, we probably all do this, right? Check your doors and make sure everything's locked.
Mhm.
It's good practice. Someone who has OCD, however, they describe feeling like, they go around the house, they check the doors, but then they're not sure that they really did it. They go back again, they do it multiple times. They may unplug the stove and the refrigerator or appliances because they're afraid something might happen to set a fire. And then that takes time and it creates anxiety.
Mhm.
So I'm
Mhm.
saying all of that to say that I really do think it's good that we've got so much information out there now that people are able to, understand more about these conditions. But it's really important to not self-diagnose and to not label either. Like, and I think unfortunately there's a lot of times, oh, I like everything to be symmetrical. That's my OCD. It's not
Mhm.
necessarily OCD. So,
Right.
there's a really good resource, Mental Health America.
Mhm.
They have an online screening tool. So folks Google Mental Health America online screening tools. They have basically the diagnostic criteria that are used for just about every mental health condition that we use in mental health practices, whether you're psychologist or psychiatrist or other type of therapist. And it's not meant to self-diagnose, but if you're curious about if what you're experiencing represents possibly obsessive compulsive disorder, you can take a look at that screening tool and it'll give you some guidelines. So I recommend not just kind of self-diagnosing based on TikTok video or something like that, but using a resource like that.
Mm-hmm. Mm-hmm.
Thinking about the extent to which symptoms may be problematic, creating distress
Yes.
and difficult to manage.
Yes, 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 yes. Not just a stickler for order and cleanliness.
Right.
So I love that. We want to be really mindful to uh, there's enough stigma out there. We don't need any extra. Uh, and I appreciate you saying, there's these differences of the level of stress, the level of time it's taking up, the level that it's impacting the day-to-day functioning, how repetitive is it? Is it it's almost insatiable or a certain amount of time? So very different from just getting stressed about order and tidiness.
Yeah, yeah, exactly. And to recognize there are other manifestations of OCD too, and I won't go into all of them, but hoarding, for example, people who have a hard time letting go of things and to the point that they've got, so many things in their house that it's creating disorder or an inability to really utilize their space.
Mhm,
The
mhm,
contamination and feeling you need to wash your hands and so on is more of a common one that we think about, but also a sense of doubt, seeking reassurance, and then symmetry and perfectionism. So there are a lot of different kind of manifestations of OCD, and the mental OCD, the people who don't necessarily have physical compulsions like washing their hands or checking the doors and the locks,
mhm,
but mental compulsions, counting in their head or needing to do things in a certain way or think things in a certain way, that
mhm.
can also be a manifestation of OCD. And so that's why, if any of this is sounding familiar or similar for someone or a loved one, it really is a good idea to at least talk with a professional.
Absolutely, absolutely. You don't have to just struggle through it. And oftentimes, when people are avoidant of treatment, things worsen over time. They don't just go away and get better on their own. And so, what a great opportunity to not have to struggle, but to really see it improve.
Right, right.
Yeah, wonderful, wonderful. Thank you for that insight and the resource too with MHA, Mental Health of America,
Mhm.
where there are those screening tools to for you to decide, do you want to start that conversation with a psychiatrist or at least with your physician to get started? Wonderful, wonderful. Do you have any final thoughts that you would like folks to know? Maybe they've been listening in and they've been sitting on some issues that they've been hesitant about in terms of their mental health. They know that they should, but they're scared. What would you say to that person listening in that's still on the fence?
I would say, if you have not ever talked to a therapist before and you're wondering if you should explore that, I would say yes. Give yourself the opportunity. I feel like I put it this way: everybody needs somebody to talk to. I'm a board certified psychiatrist and therapist, and I have a therapist.
Oh, yes.
It's just a part of my mental health practice. Now, for my own mental wellness and well-being, access to therapy can be a challenge. And so, there are resources and things to explore if access is an issue. But if the primary barrier is feeling as though, well, nobody in my family's done this, or what happens in this house stays in this house and we're not supposed to talk about, like,
Yeah.
those are things that I think that it's important to challenge, because it's particularly in these days, it's really important to have someone to talk to.
Mhm.
And you don't have to, it doesn't mean that there's something wrong with you in order to, benefit from having someone to talk to, particularly when going through certain transitions in
Mhm.
life.
Mhm.
I think it's really important to normalize the fact that we all have struggles in one way or another.
Right.
That's a part of being human, and it's okay. There's nothing wrong with it.
Mhm.
I also think, though, that it's really important, if you're going to reach out for help, to feel empowered to search for a therapist that is the right fit for you. And I know, looking at your website with the Up Company, that you've got some videos that talk about evaluating therapists and, is this the right fit for me and what am I looking for? Those things are really important. And if you don't feel like you have a good fit with someone, it's okay. You don't have to be stuck with a therapist that you don't connect with.
That's right.
But be your advocate and advocate for your loved ones.
Yeah, well said. Well said. Be your advocate. When you were talking about it, I thought about how we don't necessarily marry the first person we date. You know, you can take your time to get to know the various professionals. And I thank you for those resources. I'm sure some people are saying, you know what, I want to go see Dr. Duncan. What is the way that folks could possibly work with you?
Well, so I see patients in my private practice at Eastover Psychiatric Group. We have an office off of Latrobe Drive in Charlotte and in Ballantyne. We also have an office in Cornelius, but I practice out of those two offices. We are always taking new patients at our facility. Sometimes my availability, depending on my current caseload, there are times when I may not be able to take new patients, and then inevitably I'm able to open back up and take more patients. But if anyone is interested in reaching out, our website is eastoverpsych.com, and you can look us up there and find the information and phone number to reach out.
Okay. Thank you again, Dr. Duncan. This has been really informative and very encouraging for those who want to know more about becoming a psychiatrist as well as working with one. So thank you again.
Yeah, thank you so much, Natasha, for inviting me, and wish everyone a wonderful Minority Mental Health Month, and all the best in mental health and well-being.